COVID is still a leading cause of death in children. Each mild COVID infection increases their risk of long COVID. Long COVID is a chronic illness. There are an estimated 5.8 million children with long COVID. Long COVID has no treatment or cure. Children with COVID are 50% more likely to be diagnosed with diabetes. Mild COVID can cause brain damage in children. Please vaccinate and mask your children to protect them from COVID and long COVID.
Is your child experiencing trouble with their memory, focusing, headaches, trouble sleeping, or stomach pain? COVID is not a cold or the flu. It is a public health crisis for children. 1 in 4 children who get COVID will develop long COVID, a chronic illness, and possible brain damage. There are an estimated 5.8 million children with long COVID. Please vaccinate and mask your children to protect them from COVID.
This is your body after a mild COVID infection. It damages your body even if you don't notice it. An infection has a 10% risk of long COVID, brain damage, and an increased risk of heart attack. Each reinfection increases the risk of long COVID. By the sixth infection, many people will have long COVID, a chronic illness, regardless of age or health. 90% of long COVID comes from mild infections. Vaccinate and mask up to avoid COVID and long COVID.
Since you had COVID, have you experienced attention disorder, resting heart rate increase, reduced lung capacity, shortness of breath, memory loss, intermittent fever, loss of taste, loss of smell, hearing loss, or tinnitus, blood clots, stroke, heart attack? All of these can be signs of long COVID. Additional COVID infections will do more damage. Please keep up your vaccinations and start masking.
What would you do if you could see COVID? COVID is not a cold or flu, it's a dangerous vascular disease. COVID is airborne. It is spread in the air from unmasked person to unmasked person, and you're breathing it in. It can hang in the air for hours. Expect 2 to 3 infections a year. By infection number 6, many people will have long COVID, a chronic illness. Please mask up to protect yourself and others, because the vaccine alone won't fully protect you. COVID is spread in the air. Bob has COVID but doesn't know it. 60% who have COVID don't know it. 20% are pre-symptomatic. Every breath fills the air with more COVID. With no ventilation, COVID accumulates. Mask up with a KN95 or N95 mask. Stop the spread.